Hello, I'm Dr. Faris Hawatmeh. I'm a dermatologist. I went to school at University of Florida. I did my undergrad in human nutrition and food science. And then I went to medical school at Nova Southeastern University, where I got my degree in Doctor of Osteopathic Medicine. And then I did my intern year at Mount Sinai in internal medicine. Finally, I did my residency in dermatology at Larkin Hospital, Palm Springs campus in Miami, Florida. I chose dermatology because it's a specialty that involves a lot of medical care with a lot of medicines and as well a lot of surgical procedures. I love working with my hands, and I also love the smile that I put on my patients' faces when they come and see me. My favorite therapy or treatment is skin cancer removal. It's a procedure that saves lives, and there's also an artistic component to it. My favorite part of it is reconstruction. So after skin cancer removal surgery, you're left with a hole, usually on the face, which is the most common place for skin cancer. And when you reconstruct and you put someone's face back together and you have a barely visible scar, it feels amazing. The most impactful patients I've had are my patients with very severe psoriasis that we treat with a lot of modern medicines nowadays that have minimal side effects and great outcomes. The patients come back in a couple of months with minimal to no psoriasis, and it's incredible to see their life change and how happy they've become. It's a difficult question to answer, but psoriasis is an autoimmune disease where the outer layer of the body's skin, the squamous cells, they proliferate too much, and you get these hyperkeratotic thick scales on usually the extensor surfaces of the body, like the elbows and knees, but it can affect any part of the body. It's very itchy. The word psoriasis comes from the Greek for itch, so it's a very debilitating disease with a lot of consequences, not only uncomfortable for the patient, but also it has social consequences because people are afraid to reveal parts of their body that has psoriasis because they feel that others might think that they have something infectious or something that they can pass on to them, when that is not true. Psoriasis is not contagious, and that's one of the worst parts for patients because they get a little insecure, or friends or families don't want to hang out with them because they might see these large plaques on their skin. Here are 3 common symptoms that may indicate that you have psoriasis. One is scaly plaques on the elbows or knees that can have a gray or silverish color. 2 is severe itch in those areas. And 3 is bleeding. When scratching those areas, peeling off the skin, you may see some bleeding in the areas. Psoriasis has a great amount of treatments, from topical medications to medications that you take orally to injectable medications. Everyone has a different severity of psoriasis, so you want to make sure that the treatment is geared towards the specific patient. We usually start with topical treatments for patients that have mild to moderate psoriasis. Some of these include topical steroids, topical vitamin D analogs, and other anti-inflammatories. Additionally, we can use medications like acitretin, which is a family of Accutane that we use in patients with acne. There's also injectable medications like Humira or Skyrizi, which have come into fruition in the past 20 years or so, but have gotten better and better every year. And these medications have really been lifesavers for a lot of our patients. The most common dermatological conditions are eczema, psoriasis, acne, skin cancer, depending on the age of the patient. So babies and small children, we see a lot of eczema. We see a lot of molluscum contagiosum, which is a virus that is spread from child to child, especially in the school-aged children. Additionally, teenagers suffer a lot from acne. Mild acne in most of teenagers, but acne can get very severe and needs to be treated very aggressively. If not treated, then it can cause scarring, and it will cause lifelong effects. And then as the population ages, then with more sun exposure, you see more skin cancer. These older patients are usually seen at the dermatologist for skin checks. Many of them have a history of skin cancer and need frequent skin checks. Others have family history of skin cancers, like melanoma, and patients with history of melanoma definitely need to have their skin checked because melanoma is a very dangerous type of skin cancer that can spread to other parts of the body very quickly. A skin check is when you go to the dermatologist for a full body skin exam. We recommend that most patients do this at least once a year or more frequently if you have any history of skin cancer in yourself or the family. During these skin exams, we check all the parts of the body that you might not be able to see, including the back or the buttocks area where skin cancer likes to proliferate due to not being seen very frequently. During these skin exams, we also check for rashes that we can treat medically, and we see if there are any suspicious lesions that might need further testing. The most common cosmetic dermatological procedures include botox, fillers with hyaluronic acid fillers, lasers, and peels. Botox is botulinum toxin, and it's a neuromodulator. A neuromodulator works at the level of the neurons in the muscles, and it paralyzes the muscles for approximately 3 to 4 months. There are new treatments now that can paralyze the muscles for 6 months. When you paralyze the muscles, usually it's done in the face to hide the signs of aging. By paralyzing these muscles, you can treat dynamic lines, which are the lines that are created when you move your face. It's recommended that you do this early on in life because once those lines become static and are always there, there's no way to get rid of them. So it's always better to do this preventative treatment. Hyaluronic acid fillers are fillers that are injected under the skin. They can be dissolved if you do not like the outcome or if they cause any complication. So they are very safe and they are preferred by most providers. Lasers that are very commonly used in dermatology include CO2 lasers, which can create a full face rejuvenation. There is a downtime of approximately 7 days due to redness and swelling that can occur, but the results are amazing. Another type of light therapy that we use is IPL. This is an amplified light spectrum with a wide spectrum of light, and we can use filters to focus on specific wavelengths that we can use to target certain chromophores, which are just the targets that we're targeting to get rid of in the skin. For example, we'll use a chromophore, or we'll use a filter that will target red spots, and that is a good filter to use for patients that have rosacea. We also can target brown spots, so patients that have lentigos or sunspots, we can help get rid of those for them. A lentigo is a benign or not dangerous spot on the face usually that comes from sun exposure, and it happens when the melanocytes, which are the cells that create color in the skin, are overactivated by a lot of sun exposure, and they start to produce a lot of melanin, which is then deposited into the superficial layers of the skin, and then you're left with a brown spot. The biggest factor in skin aging is the sun. The sun can cause brown spots, it can cause cancers, it can cause wrinkling of the skin. The sun can damage the elastic fibers of the skin, creating what we call dermatoheliosis, which is severe wrinkling of the skin. It's very visible when you see, for example, a truck driver that works all day driving. The left side of their face is gonna have a lot of wrinkles, and the right side of their face is gonna have less wrinkles. Using sunscreen is the most effective way to prevent skin aging, but you can also prevent skin aging by using hats or SPF clothing. The most important aspect of this is actually to prevent skin cancer. When you have a skin cancer, if you let it get too big, it can cause deformations, especially when treating them. It's very difficult to reconstruct cases that are very big when you remove skin cancers that have been there for a long time. So it is very important to wear your sunscreen every day, at least an SPF 30, and there are different types of sunscreen. Some are chemical blockers and some are physical blockers. We recommend physical blockers for most of our patients, and those are gonna have ingredients like zinc oxide or titanium dioxide. Some chemical blockers are actually banned in some parts of the Caribbean because they are said that they can affect the reefs. So when you're traveling, try to always opt for a physical blocker. Both are safe for the skin. We recommend that you use whichever one you're gonna use more often, but some patients that have sensitive skin have less skin reactions to physical blockers than to chemical blockers. So patients with sensitive skin can get some redness, itching, or rash from chemical blockers. There are a lot of ways to improve scars. We have a lot of medications that we can use. Most of them are injected into the scar. One of the most popular is Kenalog or triamcinolone, which is a steroid. We like to mix this with 5-fluorouracil, which is a chemotherapeutic drug that has been shown to help reduce the itching of scars and to help reduce the recurrence after injection. These treatments are usually done once a month for 3 to 6 months. If these treatments are not successful, then we can always go ahead and do surgery where we can cut out the scar. This is called a scar revision. We can cut it out. We can inject this medication inside. It'll prevent it from coming back. In cases that are recalcitrant, we have used radiation therapy successfully. This is a very popular treatment for keloids, and everything really depends on the ability of the surgeon and how well they can hide the small scar that's left after they've removed your keloid or hypertrophic scar. When undergoing cosmetic procedures, you need to be aware of some of the risks, which most frequently is going to be associated with bleeding. So before you do a cosmetic procedure, you need to make sure to either visit your provider for a consultation so you can be educated, or ask them for a pamphlet which they can provide, giving you the medications or supplements that you need to avoid. Most frequently, medications that we need to avoid include NSAIDs such as ibuprofen or aspirin, which can increase bleeding, as well as vitamin E or fish oil. It is not recommended though to stop any anticoagulants that have been prescribed by your primary doctor or cardiologist for any heart conditions, as the small risk of bleeding during our procedure would not be more important than keeping you alive by taking the medications that your doctor prescribed. When it comes to choosing the right skincare products for you, first you need to think about what kind of skin you have. You need to see if your skin is more on the dry side or is it more on the oily side. Depending on this, when you go to the pharmacy, you can see some creams or washes are specifically made for patients that have drier skin, and some are made for patients with oily skin. So when it comes to sunscreen, for example, you can have some sunscreens that leave you with a matte finish, and that's really good for patients that have oily skin. There are seasonal considerations for cosmetic treatments. In seasons when there's low humidity in the atmosphere, there are some cosmetic treatments that can dry you out excessively. During the winter time, you allow your skin enough time to accommodate and get used to the dry atmosphere before undergoing these procedures, because they can become more drying, which leads to eczema exacerbations, fissures in the skin, redness, discomfort, itch. It is also imperative to understand that when you're going on a trip or vacation to somewhere cold or dry, you need to discontinue some of your skincare products that might cause more drying. For example, retinol. It is recommended you discontinue it at least 3 to 4 days before your flight or your travel to very high altitude dry areas.